Ruth Maguire, followed by Adam Tompkins.
Presiding Officer, I understand Scottish Government caution around the resumption of care home visiting, but I also keenly feel the concern of family members about the impact of loneliness and isolation on their loved one's health. Can I ask the Cabinet Secretary what criteria individual care homes will have to meet to allow them to increase the number of people who can visit a resident going forward, please?
Cabinet Secretary.
So there are two critical criteria for a care home to be able to introduce any kind of visiting. First is that they need to be COVID-free for 28 days, and the second is that they need to be fully participating in the care home worker testing programme, and not all are at this point, although that number is increasing. Thereafter, they need to have produced a plan that the local director of public health or his or her nominee signs off in terms of proper infection prevention and control. That includes ensuring that there are adequate supplies of PPE, and of course we have a role in helping with that, that the staffing rota is of a sufficient size in order to ensure that staff are there to assist residents and visitors, and the new safety huddle tool, which members will recall has been published, will greatly assist care homes in being able to work out exactly what their staffing rota needs to be in those instances. Those are the primary areas of concern. That is also, though, when the Director of Public Health, and the reason it's the Director of Public Health is because they understand the prevalence of the virus in that local area. And so from time to time, as they did in Aberdeen and in Tayside, they restrict visiting beyond what is possible elsewhere in the country in order to provide additional protection whilst an outbreak is being managed and controlled.